Hi, this is Kim McAlister, and now we're moving on to Health Education Part 5. We're going to be talking about a couple of models that we use to help design health education. And the main one that we're going to go over in depth is the health planning model. And this is based on a systems framework. And with this, we say every organization, every organism, every being, every person represents a system. And this is the system has a complex elements and mutual interaction. So we are all part of a system that has many parts in it. And so this is what we're going to look at addressing in the health planning model. So when you're getting ready to give education at the community level, you need to use a model to help design your program, to have a flow and a framework to build your program on. And so according to the health planning model, the constructs of it are that a community is an open system that exchanges things like energy and goods and services, values and ideas. And they exchange those within the environment of the community and also in interaction with other communities as they reach outside their community for other goods and resources and support and natural resources and other items. So you're asking yourself, what in the world am I going to do with this model? Well, we're going to use the nursing process to use this model, and we'll do it step by step so that it makes sense. So the first thing that you're going to do is assess before you begin developing your program. You're going to first of all assess what the aggregate characteristics are. You're going to meet with your aggregate. You're going to establish a professional relationship. This may take some time. You have to establish trust and let them know who you are and help them to understand that you're there to assist and are there for their benefit. You want to gather information, including the demographic information that you'll be collecting this week in the demographic assessment. You can always pull up the information on census.gov to find out information about your community. I used it with Medicaid when we had the expansion in 2015. In 2014, I pulled all the information on how many people were living in the poverty status for the central medically rural service area that I was in charge of during the expansion. So I pulled all of the counties in that service area and looked at the numbers of people who were in poverty status, and we used that to estimate how many new members would be joining Medicaid. So that's just kind of one example that you can use the sociodemographic information for. You also want to look at what the health status is of the community. You want to look at the strengths and the weaknesses of the community. You also want to assess the super systems. What healthcare structures are there? Are there hospitals? Are there clinics? What kind of services do they provide? Are there home health agencies? Are there other support agencies in the area? And the reason why you need to do this is before you develop and start your new education program for the community, you want to find out what other programs are already there. This way you're not spending time and wasting resources developing something that already exists. And you can only find that out if you assess and look for it. The other thing that you want to do is conduct a literature review. Those of you who have taken research understand what this is. Those of you that will be taking it in January, we will be doing a literature review on some type of health problem that you choose. So this is going to tell us whether or not the trend or the issue that this community is going through is something that's normal, or is this something out of the ordinary? Is this something that there's a lot of information on? Is this some kind of new public health threat or concern? And so you're going to be looking at all types of information, other research that's done on it, what are the statistical information that's available, what reports have been done, are there white papers, are there other resources that you can use. So then you want to identify and prioritize the specific health problems. You compare the aggregate characteristics with your assessment that you've done after meeting with the aggregate with the literature review and the demographic information that you've obtained. And then you consult the aggregate for their perception of need. So you've determined your own perception of what you think based on your interaction with them and the other information that you've gathered. Next, you want to meet with them and find out what they see their needs are. Sometimes that will be the same, sometimes it will be different. The reason this is important is that they're not going to buy into the changes that you want to make when they have other things that are of greater priority. So you need to design your priorities and coordinate that with them so that they're willing to listen to you. So you want to look at what their preferences are. Then the next thing you need to look at is how many people are affected. Is this something that just affects a small group, a large group? All of this will help determine where that falls in the priority and how you're going to approach and address the problem. You also have to look at severity of need. Although something may not be a priority for a community, it may be something that's very serious and poses an immediate threat. So that's something that would have to be addressed before addressing something that was of higher preference for them. So after you've done all that assessing, then you get to plan. And your planning is going to be based on what you assessed. You're going to create mutual goals and objectives with your aggregate. And then you're going to decide what level of intervention does it need to be. Is this something that's only a risk? Then you can use prevention to address it. Is this something that you believe is happening and you're not really sure? People aren't having some overt signs, but you think they may have been exposed to something, or a problem may be in the process of developing. So then you may need to use secondary intervention, such as screening, different types of screening tests for different problems. And then also you want to look at tertiary problems. If this is something that everyone has and they're going to continue to have it, then you need to do something to get them to their maximum level of functioning. And then you want to validate that everything that you've done is practical and makes sense, and also is within the constraints that you may have. So in the intervention phase, you're going to carry out the plan. And understand that you may make a really beautiful plan, but it may have to be changed as it goes along. There may be unexpected problems. Something that you identified as a lower priority may suddenly become a greater priority. You may have funding issues. You may have problems getting resources that you need or places that you need to carry out your intervention. And so then you have to move to other plans. So in community and population health, you have to be very flexible, and you have to have kind of a plan B and a plan C and a plan D. You don't know that you're going to necessarily have everything that you need, and then things can happen. And you don't have a lot of resources or a lot of staff sometimes to help affect the change that you need to make. So you have to evaluate to know whether or not you were successful or not. This can include verbal feedback. People can give you, come up to you and tell you this was great, this was terrible, it was awful, it was fantastic, it's changed my life. You also want to do some surveys, have something in writing so that you can have evidence that this was helpful. You may want to continue this intervention or something like it, and by having evidence that it's helpful, that may help you with funding and in getting other resources to continue it. You want to have a detailed analysis, because when you form your goals and objectives, you need to have something that you can measure, and you want to carefully analyze your outcomes and analyze your goals. And if this was an intervention that had some measurable benefit, something you can capture in statistics, then you certainly want to do that. So then you want to reflect upon all of this and look back on how your assessment and your planning, how effective was it really in the intervention phase? What could have been done differently to make it better? And then you want to determine if the outcomes that you have were reached. And again, you can only really determine that if you make very good goals and objectives. So we talked about the health planning model, which talks about the community as an open system that exchanges materials and goods and services with the environment inside and outside. And this is something that can be used for actual or potential health concerns. We're going to speak very briefly about the health belief model. This addresses factors that promote health-enhancing behaviors. It is disease-specific and focused on disease avoidance. So if you can work with people's perceptions and feelings about disease, you can help improve their health. You can also help them avoid getting the disease. So you have to look at what the perceived susceptibility to the condition is. What do people see as the severity of the problem? What are the benefits to avoiding it or carrying out the health behavior that you want them to do? What are the benefits? And then what are the barriers? What things are keeping it from being carried out? What are ways to overcome the barriers? Do you have resources to do that? Do you need to obtain other resources or assistance from other departments or other organizations to help overcome those barriers? You also want to look at the psychosocial and structural variables of what you're doing. With the health belief model, perceived benefits is the most powerful motivator. So you will get people to change their behavior if they see a benefit. If you tell them, if you don't do this, you're going to die, or if you don't do this, you're going to lose your leg, that's a much less powerful motivator than if you do this, you'll live to see your grandchildren, or if you do this, you'll be able to get up and walk again. So this is where your motivation is with that model. Okay, so that in a nutshell are the models that we're going to discuss.